tucked within the $333 billion spending package, which prevented yet another government shutdown by funding the government through the end of September, is money for humanitarian assistance at the border and more health staffers at detention facilities throughout the United States, as well as some guidance mandating better treatment of detainees. As we've detailed previously, the U.S. falls short in some significant ways when it comes to caring for immigrants held at the border and in facilities around the country. Yesterday, a 45-year-old Mexican national detained by Customs and Border Protection died at a medical facility in McAllen, Texas, after twice seeking medical attention, my colleague Isaac Stanley Becker reports. That incident follows the December deaths of 2 migrant children in government custody. Here are some of the humanitarian provisions in the spending bill. An additional $415 million to CBP in aid to migrants, including $128 million for hiring more medical professionals, $40 million for food, infant formula and diapers, and $24 million for transportation between detention facilities. Directives for CBP to brief Congress within 60 days on its progress in providing better, more consistent care to detainees, including meeting their water, nutrition, hygiene and sanitation needs. An additional $12 million to Immigration and Customs Enforcement for hiring 112 more staffers focused on health. A directive that new processing and border patrol facilities in Texas should be equipped with appropriate temperature controls and avoid chain-link fence-type enclosures. A directive for migrants to receive warmer blankets, saying CBP is encouraged to use a more appropriate blanket type than currently utilized. Trump has said little about these parts, or any parts, of the spending agreement passed Thursday, which provides far less funding for new fences along the border in Texas than he'd originally sought. The compromise funds $1.375 billion for 55 miles of new fences, compared with the $5.7 billion Trump had requested from Congress for building 234 miles of steel walls. Instead, the president has kept his focus on the influx of illegal drugs from Mexico, repeating claims that building a more comprehensive wall by declaring a national emergency at the southern border will solve what he's dubbed a national security crisis. The White House spent the weekend defending Trump's emergency declaration and seeking to clarify his contradictory statements about its necessity, my Washington Post colleague Amy V. Wang reports. Trump's announcement last week, an attempt to circumvent Congress by redirecting taxpayer money to pay for 230 miles of barriers along the Mexican border, has led to lawsuits and protests, Amy writes. California's Attorney General said he estimated about a dozen states would join a lawsuit against the White House that his office would file Monday. Various groups have held demonstrations against the declaration across the country. Republican lawmakers had different takes on Trump's emergency declaration. Yet immigrant advocates and more liberal Democrats didn't exactly get a marked win in the spending bill, either. While Democrats and Republicans have different spins on whether the agreement will ultimately result in more or fewer detentions, one thing is clear: it doesn't provide any significant change in the number of people who can be detained by ICE. The measure funds enough beds to detain a daily average of 45,274 people. That's slightly below the 49,000 people ICE currently has funding to detain, but still far more than in the early 2000s, when the agency detained about 20,000 migrants on a daily basis. Grace Meng, a senior researcher for Human Rights Watch, said given that reality, the extra humanitarian funding feels a little like window dressing. It's good to see resources being placed into making those places more humane, But I think the overall goal of keeping people safe is really undercut when there's not a real commitment to reducing the number of people in detention, Meng told me. Still, it's a positive sign that Congress is providing some funding and directives to improve the situation for detained migrants, considering that multiple independent reports have found serious shortcomings in how people held in Border Patrol and detention facilities are cared for. As I noted in January, both HRW and the Inspector General for the Department of Homeland Security have issued multiple reports raising significant concerns about their care. In the fall, DHS's Inspector General released the results of a surprise inspection of the Adelanto ICE Processing Center in Southern California. Its 2,000 detainees lacked access to timely medical and dental care, according to the report. One detainee reported having multiple teeth fall out while waiting more than 2 years for cavities to be filled, the report said. DHS's Inspector General also issued a report in December 2017 concluding that 4 out of 5 detention facilities it examined fell short of ensuring detainees were treated humanely in a safe and healthy environment. In one of the facilities, detainees were strip-searched in violation of standards. The Inspector General released a second audit in June saying ICE failed to adequately inspect and monitor more than 200 facilities it operates around the country. The same month, HRW released an analysis of 15 deaths in immigration detention from December 2015 to April 2017. It found evidence in all but one death of subpar and dangerous practices including unreasonable delays, poor practitioner of nursing care and botched emergency response. HRW also released a report in February detailing how adults and children are detained in freezing holding cells without access to beds or showers.